Hello everyone, I'm Anthony D'Souza and welcome to this series of videos on the exciting world of healthcare science.
My name is Michaela Ivanova. I am a Band 5 biomedical scientist at Great Ormond Street Hospital. I work in the microbiology department and I'm actually training to be a Band 6 biomedical scientist, so I'll be doing my specialist diploma portfolio very soon. A microbiologist works with bacteria, mostly, and what we do in my particular department is we take pediatric samples and we culture them onto certain agar, like media, and we isolate bacteria from them. Upon receiving of samples in the laboratory, it's incredibly important to check the patient details, so it's usually 3 patient identifiers, and we need to make sure that these match before anything happens. Once we've ensured that all the patient details are correct and they match, we then start the processing. We've got different samples which require different tests. So in this particular sample we have a skin swab, so we'll be culturing it over blood agar, McConkey agar and a Sarb-Dex agar. Then identifying the bacteria from what we grow in the plates. We then take the swab and we inoculate the media with the swab. We then use a technique called streaking, which allows us to isolate single colonies. So we do this with a metal loop, which we heat to make sure that it's sterile, and we then use it to streak out the inoculation of the sample so that we get nice single colonies, which the biomedical scientist can later on identify. We incubate the plates, usually for 18 to 24 hours, and the next day, once we take them out, we can actually read the plates. We do this with various different techniques. There are some biochemical tests, we can do gram staining, we can also use what's called a MALDI-TOF. So the MALDI-TOF stands for Matrix Assisted Laser Desorption Ionization Time of Flight Mass Spectrometry. What this machine does is it uses a laser to ionize and accelerate the bacteria, which then measures the mass of charge ratio of the bacteria and then the time of flight, which basically in layman's terms means that we have an idea of what the bacterial surface proteins are. These proteins, these sort of peaks that come from the mass spectrometry, are then compared to a database of other known pathogens, and the MALDI-TOF gives us a match. It's almost like a molecular fingerprint, which then gives us an identification down to the species. Once we have the identification of the bacteria, we then record it onto the system and send preliminary results to the medics so that they know if there is an infection or not. Immediately after, we need to set up the sensitivities and run antibiograms on this bacteria. We do this by taking a few colonies of the bacteria from the agar plate that we've just used to identify it from. We inoculate the bacteria into a saline broth. We then take out a swab and we inoculate it or create sort of like a lawn on a new type of agar called Muller-Hinton agar. We then stamp the plate with a series of tailored antibiotics, and that is called an antibiogram. We incubate these plates as well, 18 to 24 hours. Some of them have to be exactly 24 hours. The next day we would take the plates out and we can read them. And what this consists of is measuring the zone sizes of hopefully of the clearing around the discs. So if there is clearing around the discs, that means that the bacteria is not growing there, which ultimately means that this antibiotic is effective against treating this particular bacteria. To become a biomedical scientist, you can take quite a wider range of paths to get to do what I'm lucky enough to be doing now. So when I was in school, I had no idea what I wanted to do. I knew that I was interested in chemistry and biology, and I was good at chemistry and biology, and I looked at being a doctor, I looked at being a dentist, I looked at all of these sort of medicine-related things, and none of them quite spoke to me, but I still wanted to work within the field. I still wanted to feel like I'm making a difference, I still wanted to feel like I'm helpful, and I still wanted to get that feeling that when I go home for the day, I know that I've done something good and I know that I've helped save lives. Then I decided to apply for the biomedical scientist. And I said to myself, if it doesn't work out, at least I have a career to fall back on. If I want to do further studying, as a biomedical scientist, it sort of shaves a few years off your course if you want to go on to be a doctor or any other, range of professions. And I studied at university. It's a 3-year course usually, and there's also a sandwich year, a placement year. And I really liked it. I loved it at university. I learned so many new things that I didn't even know existed. I learned so much about new technologies and how far science has come and how far science can go. During my dissertation project, I actually worked in the microbiology field. I did some work with some antibiotics, and I loved it. And then I did my placement year, and I was lucky enough to get an interview for Great Ormond Street Hospital in the microbiology laboratory, and I absolutely fell in love with it. My biggest advice to anyone wanting to go into the field is go into the lab if you can and get that experience, because it will really change your mind. If you're not sure about it, I absolutely fell in love with it. I come into work now every single day being so grateful that I'm here, and just, I wake up and it's not like I have to go to work now. It's oh my god, like I'm going to see my team, I'm going to see the people, I'm going to make a difference. And that was my particular journey.